All eyes on St. Vincent and the Grenadines now on red alert as activity continues to heighten at the La Soufriere volcano. Our top story in your Barbados Today Evening News Update for Thursday, April 8th. Vincentian communities in the immediate path of the very active La Soufriere volcano have been evacuated. Lead scientist Professor Richie Robertson of the Seismic Research Unit of the UWI, who is in Kingston, cautioned that a significant change in activity at the volcano signals that possible explosions are imminent.
We would not be surprised, for example, if sometime between the next 24 to 48 hours, there are explosions from the volcano that are much more significant than we have seen so far. The pulsing is one thing, but explosions is different. So we seem to be clearly heading into something that might be explosive, and therefore we need to take necessary actions to safeguard life and limb.
Prime Minister Dr. Ralph Gonsalves has urged Vincentians to remain calm, assuring that government has mobilized all the resources to respond.
All arrangements have now kick-started and the process begins. I want to urge all our people to be calm, do not panic, be disciplined, be orderly. The heads of all the subcommittees in NEMO were at the meeting of the National Emergency Council, and they know what they have to do. It is a question of effecting the plans.
At a national press conference this evening, Prime Minister Mottley says Barbados stands ready to support regional efforts to assist St. Vincent.
That our prayers and our support are with the people and government of St. Vincent and the Grenadines. They are our brothers and sisters. Indeed, many of you who live here are related to persons there, and therefore we hope and pray that there is no loss of life and that the loss of property is minimalist.
In other news this Thursday, against the backdrop of falling COVID-19 cases, Prime Minister Mottley announced a further ease of restrictions, which will see a range of activities and businesses allowed to resume operations.
In addition to gyms, we are also now taking the decision for beaches and parks to be open from 5 in the morning to 7 p.m. There are to be no picnics or parties, and we're asking people just still to come out gradually, take a chance, take a time, and you can stay on the beaches, you can have their fun, but we're trying still to avoid situations of large gatherings and people mixing in a way that could cause the gains of the last 3 months to be compromised. Small pleasure craft, therefore, will also be allowed to operate at 50% of the capacity, but there will be no return at this point in time to the larger party boats, party cruises, as I think they're called, AG. And Minister Humphrey would have met with the boating community to resolve these issues. Water sports operators will be allowed to participate, and I want to say a special thank you to them.
There has also been an ease in the curfew, though authorities are maintaining some caution.
We have taken a decision that there will be no curfew on Monday, Tuesdays, and Wednesdays, and that we will limit the curfew now from 11 p.m. at night to 5 a.m. in the morning for Thursday, Friday, Saturday, and Sunday. The Chief Medical Officer is firm in his view that there must continue to be an attempt to keep numbers reduced as we move about the country, because we are not out of the woods. As a result, he has asked that we still keep retail and supermarkets closed on Sundays, but with restaurants operated, being allowed to operate. Bars will be allowed to open back, but they will operate at a cap of 50% of capacity, and equally no parties in bars. Cinemas, theaters, nightclubs, and discotheques will remain closed. And of course, we are not allowing karaoke or bus crawls or excursions at this stage. Fast food restaurants will be permitted to have patrons in the restaurant, but as we all know, physical distancing, mask wearing, hand sanitizing, and the recording of the data on the patrons entering the establishment must be adhered to, as well as all other relevant protocols.
Meanwhile, Health and Wellness Minister Lieutenant Colonel Jeffrey Bostick is pleased that COVID-19 cases continue to drop, and he urged Barbadians to stick to the protocols so the island can return to normalcy.
What the figures clearly indicate is that the positivity rate is trending in the direction that we want it to trend. Definitely below 5 for at least the last 4 weeks or so, and within the last several days it has been trending at 2%, and in some cases we've even been below 2%. So we're doing quite well in that regard. But the situation is that we still have cases, and we still want to get that rate a bit lower, but we're going in the right direction, which suggests that we're all doing what we're supposed to be doing. And I am asking Barbadians just to continue in this vein, because if you continue like this and we continue to do well, then we'll be able to do more for the country.
There's regional and international news after this short break.
Barbados Today, news you can trust.
On the regional scene, leading Caribbean epidemiologist and Jamaican professor Peter Figueroa says there is a treatment to avoid death from rare blood clots, purportedly caused by the AstraZeneca COVID-19 vaccine. O'Shane Masters of Television Jamaica has the story.
The Safety Committee of the European Medicines Agency yesterday said the Oxford AstraZeneca COVID-19 vaccine can cause unusual blood clots. There had been 18 deaths reported in its review of 62 cases of blood clots. Jamaica's Ministry of Health has been administering the AstraZeneca vaccine in its inoculation program. Professor Figueroa says the overall risk is low.
Once it is recognized early, it can be treated effectively. But the wording of the different safety committees varies a little bit. The European Medicine Agency is seeing it as a very rare side effect, and the Global Vaccine Safety Committee of WHO used the wording that it's a possibly associated. I think, it's reasonable to say this is likely to be associated with the AstraZeneca vaccine as a very rare side effect.
Further afield, a critical care doctor called as a prosecution witness in the Derek Chauvin's murder case today testified George Floyd died from a lack of oxygen caused by being handcuffed face down in the street with the former Minneapolis police officer's knee on his neck.
A critical care doctor with an Irish brogue commanded the jury's attention on day 9 of the murder trial of Derek Chauvin. The prosecution's witness testified that George Floyd died from a lack of oxygen caused by being handcuffed face down in the street with the former Minneapolis police officer's knee on his neck.
Mr. Floyd died from a low level of oxygen.
The testimony from Dr. Martin Tobin, a pulmonary expert who treats patients in a Chicago ICU, came equipped with charts, anatomical diagrams, and mathematical formulas to confirm the county medical examiner's finding that Floyd's death was a homicide at the hands of police.
We're seeing that the level of oxygen has gone down to 0. That there is, at that point, there's not an ounce of oxygen left in his body. And again, this is totally, you can figure this out with very precise science.
At one point, Dr. Tobin unbuttoned his shirt collar and had jurors feeling the backs of their necks as he described how Chauvin's knee compressed Floyd's airway.
And you put your whole palm of your hand around it. Sorry.
The judge interrupted to tell the jury they didn't have to follow his instructions.
You are not required to do anything that the witness instructs you to do, but feel free to do it if you wish.
Almost all jurors followed along. Crucially, Dr. Tobin also said the medical evidence contradicted the argument by Chauvin's defense that Floyd may have died from a drug overdose and compared the restraint Floyd was in to a vice.
A healthy person subjected to what Mr. Floyd was subjected to would have died as a result of what he was subjected to.
That's news, but for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as Screenplay and supermarkets at gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.